The biggest problem in home healthcare today isn't billing, it's nurses. You're stuck in a vicious cycle. You get referrals, but you can't staff them. You can't staff them, so you turn them down. And you miss out on revenue. This isn't just a challenge. It's a $43 billion problem of wasted time and resources annually. You didn't start an agency to turn down patients. Today, I'm revealing the Recruiting AI Agent, a proven system that finds vets and onboards nurses 24/7. This system can reduce your time to hire from weeks to days, and it never gets tired. Let's fix that. Part 1, the AI Recruiting Agent. This crisis requires a system, not just another job post. We call it AI Recruiting Agent. I've seen this firsthand with a client who had a staffing challenge. They were turning down new patients every day because they couldn't find enough nurses. Their job board ads were costing thousands of dollars a month, but they were getting unqualified candidates and high turnover. They had no system for pre-screening or engaging with potential hires. They knew they needed a better way, but every solution seemed too expensive or too complicated. We deployed an AI agent that automatically replied to every resume, asked a few qualifying questions, and scheduled interviews with only the best candidates. It's a multi-prompt agent that has different states that can handle complex conversations and adapt based on users' responses. This is how they started getting qualified nurses at a fraction of the cost, and their time to hire dropped by 75%. Here's how the system works. See, your criteria, the AI agent learns what a good nurse looks like for your agency, including license type, experience, preferred zip codes, and availability. This is all documented in a database. The agent can then look for potential candidates on social media or job boards and automatically add their information to your system. Start automated screening. The agent asks a few quick qualifying questions via text or voice call to vet candidates before a human even sees them. It can even speak multiple languages. Automate follow-up. The agent follows up with candidates and schedules interviews directly on your calendar, so no one falls through the cracks. Part 2, the nurse matching agent. Hiring a nurse is just the first step. The real challenge is retaining them and assigning them to the right patients. I spoke with the team at iCare Home Health Agency who has over 50 clinicians, but no clear way to match nurses to patients. Their intake team was manually looking at an Excel list of nurses and their preferred territories, a process that was slow and inefficient. This was a classic structure problem with a lot of no clear workflow. This led to missed patients because they couldn't find an available nurse quickly enough. We designed a scheduler agent that uses the nurse's location and preferences to automatically find the closest and the most available nurse for a new patient. The agent knows the nurse's preferred zip codes and can even calculate kicker rates for special cases, like a hard-to-staff area or a last-minute need. The agent can communicate with clinicians through their preferred method, whether it's a text message or a phone call or Tiger Connect. This is about protecting your existing team's time and ensuring they're not wasting their efforts on phone tag. This is how you can use this agent. Document preferences. Create a database of your nurse's preferences, zip code, specialties, availability. Use an AI to match it. The agent takes a new patient's needs and uses that data to find the best fit nurse instantly. Automate communication. The agent sends a text or call to the nurse to confirm the visit and can even offer a kicker rate in special cases. Get a response. The AI detects the nurse's response, whether it's on my way, not available, or anything else, and updates the system. Part 3, the nurse onboarding and retention agent. The first 90 days are critical. You can lose 80% of nurses in that time frame because of poor onboarding and administrative work. Our final agent solves this. I was recently on a call with a home healthcare agency in Maryland. His back office was disorganized and there were no standard way for staff to take notes. He said, "My nurse wouldn't forget this on the report. I got to so much problems." He lost a client because of one error in a note. This shows that even simple mistakes can lead to a loss of patience and revenue. He was looking for a solution that would make documentation easier for his staff, but no one had a system that could easily integrate with their processes. We had a scribe agent that can call the nurse after a visit and ask simple, direct questions. The nurse's verbal answers are then automatically transcribed and used to complete the visit notes, which are then saved securely in the patient's file. This reduces the documentation burden on nurses, which is a major cause of burnout. Here's how you can use this agent to boost retention. Use a voice agent for post-visit notes. The agent can call the nurse after a shift to ask a few simple questions about the visit, such as, "What time did you arrive? Is there anything you would like us to be aware of?" Automate documentation. The agent's conversation is transcribed and used to automatically fill out the visit notes in your EMR. Close the loop with the patients. The agent can also call the patient after a visit to get a QA survey, ensuring satisfaction and gathering valuable feedback. Build a culture of appreciation. The agent can ask patients to recognize nurses who did a great job, boosting morale and retention. Recruitment is no longer about just posting ads. It's about building an automated system that finds, engages, and retains nurses. The agency that has the best staff wins. Your staffing problem is just the first step in building a more resilient, profitable agency. In our next video, I'm showing you the growth engine, a system for predictably expanding your agency's territory without adding complexity or risk. We'll show you how we've helped one agency grow their census from 275 to 388 patients by simply tweaking their marketing. Click here to see how to predictably grow your agency. And for now, download the Nurse Recruiting Blueprint from the link in the description to start your automation journey today. Your nurses will thank you, and your bottom line will too.